are in listen-only mode.
Good afternoon and welcome to our webinar on coaching your community's journey toward health. My name is Kitty Jerome and I'm the Director of the Action Center at the County Health Rankings and Roadmaps program. I'm joined today by Stephanie Johnson, a community coach in the Action Center, who will be helping answer your questions as well as sending out some links via the chat box throughout the webinar.
Hello everyone, glad that you're with us today.
We're excited to be joined today by two additional community coaches from County Health Rankings and Roadmaps, and they're going to be talking with us today about the coaching program.
Hello everybody, this is Jan O'Neill. I look forward to this webinar.
And this is Kate Kunkel. Hi everybody.
Before we begin, we'd like to share a little bit about our relationship with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. We also want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. On the left of your screen you'll see the viewer window. That's where you'll see our screen throughout the presentation. On the right you can see a control panel where you can interact with us. Please feel free to ask questions or share your thoughts and experiences with us throughout the webinar by using the control panel. I've circled the place where the questions box is. We'll be sure to leave time for your questions at the end of the webinar as well. And here's a look at what we're going to talk about today. So I'll start with a brief overview of the County Health Rankings and Roadmaps program to set the stage for our topic today, and then we'll dive into a conversation with the coaches about the coaching program, what the coaches do, what we can learn from communities, and then a little bit of information about how you can apply to join the coaching program if you're interested. We like to begin our webinars with an essential question that you can keep in your thoughts throughout our webinar today. So we're going to be hearing about lessons the coaches have learned from working in communities on their journey toward health improvement. Today's essential question, therefore, is, how can our community apply the lessons learned from coaching? Now, we want to hear from you today to hear a little bit more about who is in our audience. And so I'm going to ask Jan to launch the poll that some of you may have seen on the screen at the very beginning.
So I've just launched the poll here, and what we'd like you to do is check as many of these as apply. Which of the challenges are you experiencing, if any of these? And I usually give us about a minute to answer this, and then I'll publish the poll results. So thank you very much for participating in this. It looks like about half of you have already. And what this does for us too is it helps us focus on those things during this webinar that hopefully will really be targeted at some of your challenges. And actually, as I'm looking at the results coming in there, they're pretty much evenly spaced across all of the challenges. I'll give you just another couple of moments here. And then I'm going to close and count down 3, 2, and 1. And sharing the results. So as you all can see, the largest challenge, I think, or the most frequently cited is the engaging community members. And we do plan to talk about that in this webinar. That's closely followed by engaging stakeholders from different sectors, and we will also be talking about that. We are going to be talking about policy-oriented solutions and coaching for that, and I think we want to make sure, Kitty, that we do touch on the making use of resources and measuring and sharing results. So this is really helpful that you all shared this in the poll with us, so thank you very much.
Great, thank you, Jan. So we'll begin now with just a quick overview for those of you who are less familiar with the County Health Rankings. We rank the health of nearly every county in every state, and for each county you're going to find two rankings, one for health outcomes and one for health factors. And we think of those as snapshots of today's health, the health outcomes, how healthy a county currently is, And the health factors represent how healthy a county might be in the future based on the many factors that influence health. So that's a picture of tomorrow's health. This model is our model. This is our method of looking at health outcomes. So the rankings provide a picture of how important it is to build a culture of health where getting healthy, staying healthy, and making sure our kids grow up healthy are the top priorities. And so the model shows the relationship between policy, the health factors, and the health outcomes. It illustrates multiple factors impacting how well and how long we live, and how things like the quality of our schools or clean air and water can connect to our health outcomes and have an impact there. So starting at the bottom, we know that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. And although there are many factors that can affect communities' health outcomes, we look specifically at health behaviors, clinical care, the social and economic factors, and the physical environment. And for each of those, we're measuring for the length of life and the quality of life. And while we're using this model, we really think about how it takes everyone across all of these sectors that represent the different health factors to work together to improve the health of a community. And we need to move as quickly as possible from this data into action. And so that's where the roadmaps piece of the program comes into play. Why do we rank? We rank counties within states because this provides community leaders with a tool for calling their communities to action. When the reports are released each spring, they garner a lot of media attention, and that in turn provides community leaders with the opportunity to mobilize people, to get involved in taking action collectively, to use the evidence that's available to them to focus on the community's health priorities. This action will ultimately, over the long term, result in longer and higher quality lives for children and adults in the community. So across the top bar of this logic model is the county health rankings, and when we start to move down the right side there from broad community engagement, we're working a little bit more deeply into what we call the roadmap side of the work. And when you go into roadmaps, you'll see the take action cycle, which is the how within rankings and roadmaps. If the rankings are the what, the roadmaps are the how. This lays out the process communities can follow to improve health, and this is where the coaches spend most of their time with communities, assessing the appropriate key activities to be conducted that will bring the community closer to meeting their goals. So this interactive cycle provides everyone with access to over 200 distinct tools for action, along with guidance for considering the steps to community health improvement, and some links to further readings and resources. In brief, the cycle looks very familiar to you regardless of how you enter it, but it starts with gathering information to assess needs and resources. From there, you want to focus on what's important and set priorities. You might look then to find the most effective approaches to addressing your priorities, and then get to work on implementing that, acting on what's important. And of course, evaluating throughout that cycle will help you improve your strategies and ensure that what you're doing is effective. You'll see that communicate sits in the center of the cycle because communication with stakeholders is essential throughout the take action cycle. But at the heart of the take action cycle is people working together, because we know that solving issues like childhood obesity or inadequate health care require the wisdom and resources of everyone in the community. And so if you go to the website and click on the Roadmaps tab at that upper toolbar, you will find a selection of tools within the roadmaps. You'll see the Action Center, which I've just been talking about, which provides you the guides and the tools for using in your community. But you'll also see the What Works for Health Evidence Database, which is where you can review expert ratings of hundreds of strategies to improve health outcomes. And you'll be able to see, are they supported by the evidence? You'll look at the resources for that. You'll also find stories and articles about our community grantees and national partners. But finally, you'll also find a link to the RWJF, the Robert Wood Johnson Foundation Culture of Health Prize. The Culture of Health Prize is where we have been highlighting communities who have found themselves on this journey toward health improvement and been meeting successes. They have been working to identify and address the problems in their community, working collaboratively across the sectors in their community, across the broad definition of health in all of the health factors. They've developed some sustainable measures, and they've used their resources wisely and creatively. These communities are winners. The prize winners have competed in a national competition to be recognized for the work that they've done. So in 2013, 6 winners were selected, and in 2014, 6 winners were selected. I think Stephanie is chatting out some links to you now about the prize, both about how you can understand about the competition, for which we have a call for applications open now for the 2015 prize. Applications are due September 17th. But she's also going to send you some links to see a video of each of the, you can look for videos of each of the current winners dating back to 2013. So there are 12 videos that tell you a little bit more about these prize winners. Finally, last month on our Take Action webinar on July 29th, we hosted a guest from an inaugural 2013 prize-winning community of Fall River, Massachusetts. And the webinars are archived, so you can find the webinar with David Weed at the link that Stephanie has chatted out. In Dave's own words, he talks about the prize application process and says just going through that application process was immensely instructive, as we rarely get a chance to tell our story to a group that is truly interested in what we're doing. So his encouragement is to take a look at that prize application in your communities. Some of you will recognize these points on the screen now as the criteria by which the prize applications are reviewed. We look at these criteria when we talk about coaching because these provide a basis to build a community's approach to health improvement. While we are not coaching communities to win the prize, we are coaching everyone to build a culture of health, and these criteria are guideposts to doing just that. As we transition to our main conversation theme today, I'm going to point out that with thanks to the support of the Robert Wood Johnson Foundation, we have 4 community coaches in the County Health Rankings and Roadmaps program, and our assistance is available at no cost to you. Today you're going to hear a lot more about the coaching opportunities from 2 of the coaches, and we'll be sure to give you all the information you need to access this resource if you choose. For now, you're going to find this orange box that says Get Help throughout our website, so you can send us an email anytime. Additionally, I will point out that this webinar is being recorded and will be archived, as all of our webinars are, on our website. So to begin, I'd like to welcome Jan O'Neill. Jan has been a community coach with the County Health Rankings and Roadmaps program for 3 years and was part of the team that first developed the guides and tools in the Action Center. She was instrumental in leading the development of the Roadmaps coaching program, having created a similar national program for educators previously in her career. Jan received a Master's of Public Policy and Administration degree from the University of Wisconsin-La Follette Institute. She has over 25 years' experience in organizational development, having worked in a variety of environments including healthcare, government, the private sector, and education. Thanks, Jan, for joining us.
Thank you, Kitty.
Also with us today is Kate Conkle. Kate joined the University of Wisconsin Population Health Institute in 2010 as a program manager with the Healthy Wisconsin Leadership Institute. She provided guidance and support to community partnerships across Wisconsin in the areas of collaborative leadership and health improvement planning and implementation. Prior to joining the Institute, Kate was a Wisconsin Population Health Service Fellow in the Wisconsin Division of Public Health Western Regional Office in Eau Claire. Kate supported health departments with their community health improvement planning process and has a leadership role on a statewide project to prepare the state and local health departments for their national voluntary accreditation using assessment and quality improvement. Kate holds a Master's in Public Health from the University of Alabama in Birmingham and a BS in Human Development and Family Studies from Penn State. Hi, Kate.
Hi, Kitty. Great to be here.
So I'm going to start with Jan today. Jan, can you tell us what is coaching?
Well, what I'd like to start with is actually what coaching is not. As coaches, we don't advise on how to implement specific programs or policies. We're not an extra pair of hands to, for example, draft a plan for action or design a survey. But we like to think of coaching more as we're more like guides on the side. We're not in the boat with you, but we're at your side, able to see the big picture, offer encouragement, ask questions that will help you steer your course a little more skillfully. In other words, what we try to do is invite people who are coaching, the participants, to explore ideas and questions and tools and resources versus telling them what to do. And we do this over a period of time, and that time frame is based on the complexity of the coaching goal, using distance technology with a small team of 4 to 5 people who can then carry the learning back to their larger community. So the idea here is we're guides on the side. And we pose questions that help the teams reflect on their work. It's a big part of the process. And a real benefit is that coaching, it's a time for the team to come together and really focus on a key challenge or an opportunity for moving their community health improvement work forward. It allows teams to kind of step back and view their work with objectivity to plan some new ways of approaching things. So I would say that's what coaching is. And I want to, just to go on with this, the challenge of community health improvement work is that there's often no one right answer or one right way to do things. So as coaches, we have the advantage of working with lots of different communities to see what works well in a situation and what things tend not to work. And we also have the time to research and explore best practice tools and resources for working on the work. But because the people we coach also have a lot of knowledge and expertise, and they are definitely the experts on their community. So we can help them leverage their knowledge to fully explore options or potential solutions using our tools and resources. So that's really what a coach is in a nutshell.
That's very helpful, Jan. Thank you. Kate, could you provide us with an example of coaching?
Sure, Kitty. So one of the communities that I have been working with wanted to create messaging around their issue of active transportation for each of their main stakeholder groups, schools, businesses, the municipality, and broader community. So first I introduced them to a tool, 2793, which is a great tool for creating a concise message. And we worked through that using one of their stakeholder groups during a call. And we also spent some time on that coaching call brainstorming the what's in it for them. What do they care about? Why do they care about this issue? In the case of businesses, they actually had someone from the Chamber of Commerce on their team who was really able to give some feedback and share why businesses care about active transportation. And this was a huge aha moment for the team. They realized that they had often really thought about why they thought stakeholders should care, not always actually why they care, because they didn't necessarily have that perspective. So I also remember one of the team members saying, wow, this just clicked. This process really gives us room to learn from each other. And she was exactly right. I had asked some of the questions to get the discussion started and gave them a tool to help frame that discussion and their work. But as a coach, I really created space for them to learn from each other and to be able to figure out the best direction for their unique community.
Wow, that's great. Thank you. Jan, can you tell us a little bit, how do you keep teams on track to meeting their goals?
So a lot of what we do is, well, first of all, we start with where the team is, what is their own coaching goal, and they set their own goals with help from us. So, for example, one team wanted to learn ways to better engage their community in this work, and another wanted to bring more partners together to work on their community's priorities, while another team I'm working with had already developed a plan for action, but they wanted assistance in how to build in evaluation. And sometimes a team will start out with one coaching goal, and that changes as a result of further reflection. So, for example, the team that started out thinking their focus would be on perhaps building support for implementing a program, and then that team shifted to choosing a policy that would have the greatest likelihood of being adopted by their community. The coaching process itself, with regular monthly appointments and between meeting work, helps the team build in accountability to their own goals. And the important thing is to create space, as Kate said, for the team to reflect on their goals and get on the same page together and readjust as needed.
Okay, these are really helpful pictures of a coach in action. And it sounds as though there's a number of roles that the coaches play with communities. Can you talk about a couple of these roles and give us some examples?
Sure. As a thought partner, I would say this is one of our key roles. We are there, again, as a guide on the side to help communities think strategically about where they can get the most leverage for their efforts. For example, thinking about what are the upstream causes of the health issue you're working on. What social, economic, environmental conditions might be the root cause of the health issue? This kind of question can lead to rich conversations about the things people could work on for more long-term sustainable impact. One community I'm working with is building economic development strategies into their community health plans because they recognize that obesity is correlated with poverty. And then as a connector or matchmaker, we help connect people within communities that are doing similar work. As an example, a public health group wasn't getting much traction with a complete streets policy plan, but by connecting with a statewide group that had expertise in complete streets, they were able to get support and assistance. And we also connect communities to each other. So Kate and I are each coaching teams that are working on a food access community survey, and we were able to connect the two teams so they can share their approaches and kind of cross-pollinate and get new ideas from each other.
And that can be so rich. That's really a wonderful role to play. Are there other roles that you're playing? So far you're a connector, you're a matchmaker, you're a thought partner. What else are you doing? Kate?
So as Jan and I both mentioned before, and want to reiterate again, as coaches we really want to create space for learning. And we do this in many ways. One way we do it is by structuring calls to highlight and demonstrate processes that we feel are valuable to partnership learning and work. We want to help teams understand the power and value of reflection, and we want to work to model that in our calls. It's so easy to get caught up in the doing that it's sometimes hard to remember to stop and actually think about and look at what you've done, what you are doing and where you're headed. As coaches, we can create space and allow time for this critical work. So I often start calls thinking about the successes that have happened since the last call, challenges or hurdles overcome, or about what the team is grateful for about working with their team. This gets people thinking about what's going well and appreciating and celebrating that. In coaching and in coalition work, we're often focused on addressing challenges, but it's so important to keep in mind the great work that's been done. So I encourage and help communities that I'm working with to think about how they might use this in their own coalition or community meetings. But we're also really action-oriented, so we often end calls thinking about the concrete next steps to make sure that there is clear direction and that the work is moving forward in some tangible way. Again, we encourage teams to use this model in their community work, really thinking about ending with action steps. What needs to happen next, who will do it, and by when. And this helps to hold people accountable for the work. We often hear one of the positives of coaching is that we hold our teams accountable to get some things done and how important and motivating that is. And I like to remind teams that they can do that too, that while an outside coach maybe makes a little difference, that we as coaches aren't the only ones who are able to do that. So when teams say things like, it's really helpful when you do X, Y, and Z, I often reply with, well, how can you keep that going in your coalition once that's done, once their coaching is done? And finally, while we ask a lot of questions and build in some processes to help teams get to solutions, our role is to be responsive to what communities need, and sometimes that means being a bit more directive and helping a team better understand how to use some of the guidance and tools in the Action Center. We'll walk through step by step how they might facilitate a tool with their partnership or community. And our goal is really to teach how to facilitate the process, not do it for you. We really want to build that local capacity. So again, when the coaching relationship ends, that team or individual feels confident to be able to continue to do the work. So one example of what this actually looks like was one of the other coaches, Karen, was working with a team on how to use the affinity diagram. So the affinity diagram can be used as a root cause analysis tool, and you can see the steps that are listed here. Karen walked her team through these steps and allowed them to see how it was facilitated, and then they had the opportunity to ask some questions so that they could feel comfortable and take it back to their larger partnership and use it with that group. Now, because most of the coaching we do, as Jan mentioned, is via distance technology, we sometimes get creative with how we are able to work through and teach these tools. So this is actually a picture of a virtual affinity diagram that Karen worked on with her team. She created these virtual Post-it notes and was able to move them around on the slide just like you would in the affinity diagram in person, so that the team could really get a sense of what it would look like in action.
Wow, that's great. So it's an online interactive process that you're doing with the teams. So what can we learn from communities who are building a culture of health about how they're really doing it? What are the most effective strategies communities can apply to their own situations?
Well, this is Jan, and I would start with the biggest learning I've seen is a constant relearning. No one individual or collective group has to do it all. That's a big aha for a lot of teams. We really do accomplish so much when we can band together with others working toward the same end goal. And by expanding the active engagement of a broader sector of stakeholders, we can have more power to get things done. So I'll give it the example again, keep going back to this Complete Streets, because I think it illustrates this really well. There was a team that didn't want to take on the Complete Streets policy work because they didn't have the right people in the room. They had it in their plan, but the right people weren't in the room. And by thinking through who else may have the same interest and is already working on Complete Streets, they were able to reach out and join with others in municipal planning departments, and they didn't have to take the lead. And the question moved from how can we work together, move to, how can we help and how can we work together? Here's some skills and resources we can bring, versus always asking, well, how can we get so-and-so to join us? How can we get them to our table? It really was about moving it over to somebody else's table into another part of the community. So that was very powerful for them.
So one of my key takeaways is really about relationships. Building trusting relationships for collaboration on the end goals is not an event but an ongoing process. The relationship building takes time and is so crucial to building trust, and trust is critical to long-term successful collaboration. One community that I'm working with, when they were reflecting on where they are in terms of meeting their coaching goal and also on what successes they've had since we've started coaching, realized that they're a little bit behind their initial timeline that they set for reaching the goal, because they didn't realize at the beginning how much time the relationship building actually takes. And that they're really comfortable with adjusting the time frame because they're seeing how things are working differently in their community and with these partners, and how critical those relationships are to getting their work done and to setting the partnership up to be successful long term. They know they aren't working on a short-term problem, so just inviting people to the table isn't enough. On one call, they talked about a successful meeting they'd had with a group of stakeholders and how well it had gone. And when I asked what they thought made it go so well, they replied, "We went as listeners." This was actually something we had talked about during one of our coaching calls, how you might approach potential partners. And this was a big shift for them. But the goal wasn't just to get people to be part of the group, it's to build a relationship and to get to know each other, see how you fit, see how you can mutually benefit from the relationship. And that takes time, and it might also take a different approach.
This is so important, Kate. I like a quote that I heard recently from one of the prize communities when she said, "We can only move at the speed of trust." Trust is such an important part of the community relationships. So it's part of sustainability too. How do the communities sustain the partnerships? How can you coach for that, really?
Yeah, this is a challenge that we see for many communities. And generally we see that communities that are more successful in the long run when they move away from being what I would say are event planners and program planners towards really being a catalyst for change and the kind of change that can over the long run create healthier lives, healthy communities for all people to live, learn, work, and play. So partnerships sometimes come together under a grant to complete a project. This is a pretty common thing. And when that money runs out, they often struggle to continue their work. And we've seen this with some of the communities that we work with. Program planning and event planning have a place, but coalitions and partnerships aren't always the best place for that. One reason is that this kind of work is often work that's in addition to your day job, and when it's extra, people get burned out pretty quickly or it falls off the priority list. I've heard from a few people, this is less than 1% of my job, and it becomes a challenge. But shifting thinking to thinking about how you can mobilize action for long-term change can make your work more successful and more sustainable. So this means convening the necessary partners, coordinating current efforts that are already working to make them have a greater impact, identifying gaps where there's more that needs to be done, and then advocating for evidence-informed action and, when appropriate, innovation. And really advocating and driving policy systems and environmental changes. So this is really hard work, yes, but in the long run, it's more sustainable and has a bigger impact. And as you work to develop a partnership that moves towards improving a specific shared outcome, the work can really become part of what you do and not an extra thing to do.
Thank you, Jan.
And I would just jump in here, Jan here, and say another huge lesson that we've seen demonstrated is that when the focus becomes ensuring that all walks of life are included in the work, that we're collaborating across the community sectors of health, education, business, and faith, we can begin to close the gap in disparities that we see. And this actually is, it's kind of interesting. We had a question from someone in the pre-registration who would like to learn more about faith-based community health initiatives. So here's an example. In one community that I've been working with, congressional members of a local church are leading running clubs and exercise classes and nutrition classes, and they're staffing an accessible health clinic with the support and training of the nearby hospital, which is a strong partner. And they're part of a national United Methodist movement to grow health education centers in all their churches across the country. And they started this movement at their church by first building awareness among the congregation about the many factors that impact health. And they shared the data about their county from the county health rankings. And then they reached out to members and just asked. They asked how they wanted to get involved, what they wanted to do to make a difference. So that's just an example of sharing data and then through the data engaging the community.
Mm-hmm. That's great, Jan. And I'm just going to take a note of the fact that Stephanie has been chatting out as we go some examples of what Kate and Jan have been talking about, both the tools and some of the stories, including that last story Jan was just talking about. So you'll find those links in your chat box, and we'll also post those along with the archived version of our webinar when this is done. So one of the participants on the registration for this webinar asked, how can we reach the population that does not want to change?
We do hear this question, and I guess I'd start by asking, what's the population that we're talking about, and how do we know that they don't want to change? There's a saying, people don't resist change, they resist being changed, which means it's important that any solutions for a community really should be owned by that community. So one of our roles is to encourage teams to encourage their partnerships to go out into the community and listen and build one-on-one relationships, build partnerships, understand the needs first before prescribing solutions. What are the barriers? What are the environmental conditions like transportation, safe parks, accessible foods, language that are keeping people from being able to change? I've heard a quote recently that around here a lot, which is nothing about us without us, which I think is a really great motto to remember all the time.
That's a nice one to remember. Thank you. So how can someone who's listening today know if they're ready for coaching? What's required? Kate?
Sure, so some thoughts on that. First, I think, all of our coaching communities look different in many ways, but they all have a few things in common. For one, they really want to learn. They're coming with open minds to try new ideas, and they're open to the coaching process. That idea that we aren't here to give them answers, but rather ask some of the important questions that help them find solutions that work for them, and provide some guidance to help them get where they want to go.
And I would add that they're also ready to set goals for learning, whether it's about how to put together a campaign for getting a policy adopted or how to reach out to new partners or build evaluation into their initiative, whatever that missing piece is for their community health improvement work. And I would say a big readiness factor is their willingness to set aside time for this learning, not just time for the coaching calls, but also time as a team to reflect on and apply the learning back home, if you will, in their communities and with their partnerships.
Yeah, and finally, this is Kate. I would go back to that idea of shifting from event planner to mobilizer, that communities that have either made that shift and maybe need some guidance on how to continue that work or maybe how to broaden that work to include the factors that most impact health, particularly those social and economic factors. Those would be great communities for coaching, and as well as communities that are working to make that shift, that recognize that they've maybe traditionally been event and program coordinators, and this is really where a lot of communities have been, and they really want to figure out how to take that step and make the shift and get people excited about policy systems and environmental change, and maybe need some guidance on how to do that work and maybe who to do that work with.
Okay, thank you, Jan and Kate. On the screen now, you should see the process for consideration for coaching. It's really pretty simple. You can send us an email outlining your request for consideration in coaching using the Get Help box on our website. Provide a brief 1 to 2 sentence snapshot of your community's health improvement journey or some of the questions that you have about coaching. Maybe a snapshot of your goal for coaching, how it could help you or your community. And a coach will get back in touch with you to discuss the next steps. This email coming from the Get Help box comes straight to the Action Center and right into the hands of the coaches. So the coaches will be ready to have an email or a phone conversation with you about the next step. We do have an application process and are occasionally capacity limited by size, so we may have to start a wait list at times, but we will certainly be in touch with you to provide an initial conversation. Now let's see if we can answer some of your questions. What else do you need to know to take action or to use this information? Who could you share this information with? What ideas do you have as a result of this discussion? Stephanie, have we got some questions from participants today?
Hi, Kitty. This is Stephanie. We have a question about the difference. Can you talk about the difference between the principles of health coaching and health education, and can those be done at the same time?
So this is Kate, and I will answer that question, or try to. I guess when I hear that question, I think about the difference between health education and health coaching, and coaching for me is that health education is generally really focused on those health behavior areas. So how do we help people understand more about healthy decisions and make those healthy decisions? So in areas around tobacco or diet and exercise, we see this a lot. And it's an important component of doing community work and health improvement work. Coaching, though, really focuses on process. So what are those processes, what are those foundational things that a community coalition or partnership needs to have in place and work on to really be successful in implementing those various strategies, of which health education might be one. So things like building or developing an action plan, building those partnerships, building trust among partners. So that's really where we focus coaching, and then health education is really sort of more of a strategy that the communities may use as part of their implementation.
Great, thanks, Kate. Another question that has come through is related to the application for community coach. So can we apply for a community coach? And maybe we can just go through that process again for our listeners.
Sure, and I have just put the screen back on, so you should be seeing the how do we apply screen. And I'm going to ask the coaches to talk a little bit more about the range of coaching that we provide through the coaching program. So Jan, would you do that?
Sure. So we are here, and again, want to tip a hat to the Robert Wood Johnson Foundation for supporting this coaching. We are here to answer any questions that come through. So even if you have a quick question about how to use a tool or who else is doing this work in my area, please definitely get a hold of us through email, and we will get back to you very quickly, either through email or a quick call. We can also get into a little bit more of a conversation if you have a complex challenge or issue that you want to get some team coaching for, and again, that's what you're seeing here. Is send us an email and let us know what that challenge is, what's going on in your community, and we'll be back in touch with you right away. So anything from right away and a quick turnaround to, well, maybe we want a little more extensive process coaching with the team.
Okay, great. Thanks for explaining that, Jan. And again, that button is on our website throughout, so I'm going to flip forward now and just see if there's any wrap-up statements from either of the coaches to conclude this, and we'll move into some closing slides. Okay.
Sure, I can. Oh.
Sorry, one more question just came in, Kate. This is Stephanie. What is the first question a community should pose as it begins the task of improving their community's health?
So that's a really good question, and I would say before you can start improving your community's health, you need to know what it is that you want to improve. And this is really where the county health rankings themselves can come in. It gives communities an opportunity to look at their snapshot, get a sense of what's going well in their community, where there might be some challenges. But a reminder that the rankings themselves are really intended to be a conversation starter and a call to action. And I would encourage communities to then really look at the Assess Needs and Resources guide to see where they may want to find some additional data. There's great tools in there on collecting community level data, doing surveys, doing focus groups, how to get information and work with the community members, as Jan mentioned before, really making sure that you're taking into account sort of local context and what people are concerned about. So I think the first question you want to make sure you ask is, what is it that we want to improve?
Great, that's a good point, Kate, is that it always does come back to the community, gauging what they need to improve, looking at the data, looking for that evidence-informed action that they can be taking. So, Stephanie, I'm going to see if we have some more questions, and meanwhile, I'll just remind folks that you can pop questions in through the chat box on your screen. Stephanie?
Thanks, Kitty. We do have a couple more questions that have come in. One question from James is, what was the United Methodist Health Movement?
Yeah, this is Jan again. I referenced that. The United Methodist churches based in Washington, D.C. Actually have a very strong health movement that they've mobilized in all of their churches across the nation. And so what I'll do while we're still on this webinar is Stephanie can maybe chat out that link. I'll find it for you and get that in. I'll put it into the chat link. But I think what I would do if they have stronger interest in that is go to that website and then contact them, because the great thing is that there are Methodist churches all over our country, and they do represent a great diversity of our population, and there's some really wonderful things happening through that movement.
Thanks, Jan, and I see that Stephanie has chatted out that link, so you should find that in your chat box now. And again, it'll the John Wesley story, and another one will be following shortly from Jan to connect you more to the national picture. Okay. Stephanie, another question?
Another question. How do you suggest assessing communities' assets to use to support their community needs?
Yeah, that's a great question, and I'm glad someone asked it actually, because I think that we do often, I think as we talked about with communities not always recognizing the good work that's being done, communities also tend to focus on what's not going well and forgetting to really look at the assets in their community and what they do have to build on. And so in the Assess Needs and Resources Guide, I'm actually working with one of my communities who's been doing a lot of asset mapping and really looking at what's our starting point? What do we have going well? What do we have to build on? One, to make sure that they're not duplicating work, but two, to make sure that they really know what's going well and can let people know about that in their community. There are some great tools in the Assess Needs and Resources Guide. There's one I'm thinking about right now from the Rotary that I've been using a lot with this team that has a whole list of it's asset mapping and other sort of community-oriented and ways to get community involved in the discussions around what truly are the assets in our community. So I think using that as part of the assessment and making sure, you know, when we look at that guide, it's called Assess Needs and Resources. So we really do want communities to think about what they have available that they can build on, and then from there they can also identify the gaps and where those need to be filled and ways to potentially do that.
And Stephanie again here, this is a question that I am really intrigued by. Is there a community that has reached an optimal status for health, and can we see their progress or their process?
So this is Jan, and I think that's where our Culture of Health Prize winners come in. That's why Robert Wood Johnson Foundation has made these wonderful videos to showcase and put a spotlight on what does it look like when a community is really mobilized, come together around building a culture of health. And there's lots of different kinds of examples there: urban, rural, native tribal nations, south, northeast, they're west. So definitely, Stephanie, I'm sure that you can chat out that link again from the prize winners, and would definitely encourage people to go and take a look at that.
But I would also add to that you know, the Culture of Health Prize isn't necessarily for communities that have achieved an optimal level of health, and that's really important because we want to recognize communities that are, you know, looking at those 6 foundational areas and are doing that kind of work. So they're putting in place the structures, they're putting in place the partnerships, they're thinking broadly, and they're improving health in their community. It doesn't mean that everyone there is as healthy as they could be. It means they're putting in place infrastructure, policies, partnerships that are going to help the community to move in that direction. So I just don't want people to be discouraged from applying for the prize if you think, well, we aren't the healthiest community in our state, so you know there's no way we can get there. It's about putting those things in place and having them in place so that you can continue to build that culture of health. But I'm not aware of a community that's reached the optimal one. If you think you have, apply for the prize and let us know so we can share that. But definitely I think our work is to help communities strive for that.
That's a great clarification, Kate. Thank you. And this is Kitty again. I think that's a really important point, that communities are always on a journey, and that's why we call this a journey toward health. And we hope that that all of your communities are also on that journey and moving forward. And we hope we've given you some tools today to use in your journey, and that you have some further steps that you can take and some places to look for more resources. I'm going to start to move us toward a few more slides that we have here. We do want you to know how to stay connected with us. We have the Facebook page, of course. You can follow us. You can pay attention to our Twitter, and you can sign up for our e-newsletter so that you can receive notices of these webinars and other important dates and events and programs that are applicable. So to reach us through there's an email address on your screen. Send us an email to subscribe to the e-newsletter. I also want to share one more piece about the prize because we've talked a lot about the Culture of Health Prize. It's a really important part of this program, and it's currently live because we have the applications due on September 17th. So we want to be sure that people know how to find that call for applications, the website for all the information, and also there was a webinar that was an informational webinar held on July 22nd to tell people about the Culture of Health Prize and how to apply and what you need to know about it, all of the important information about it, and that is archived on our webinar site on our website. So these links are being chatted out, but they're also on your screen to take a look at. Our final acknowledgments, we noted in the beginning of the webinar that the County Health Rankings and Roadmaps program is the result of contributions of many partners, and we list them here. We're very grateful for the Robert Wood Johnson Foundation support, which allows us to bring all of this information to you. And back to our essential question of the day, how can our community apply lessons learned from coaching? I think we've explored some of the stories and some of the processes of coaching and thought a little bit about some of these ideas that could be applied in your community. Expanding active engagement, building lasting, trusting relationships across the community, thinking about how you can move from event planning to mobilizing community action, to becoming a catalyst for change in your community. Engaging all of the members of your community, especially those most affected, and really thinking about how you can apply the data to move into action. So we thank you for joining us today. Kate, Jan, Stephanie, thanks so much for contributing your expertise and your experiences with the coaching communities. We look forward to hearing your ideas in the future for future webinars, hearing your lessons from your community engagement work. Please share with us freely and use the Get Help button to get directly to a coach. Thank you so much.